Open Your Eyes is brought to you by the Belize Bank. Our country, your bank.
Good morning. Welcome to Open Your Eyes.
Start your morning right.
I'm Marlene Cuellar.
And I'm Gavin Courtney.
And thank you for joining us this morning.
It's a bit cooler than some other mornings that we've had recently.
Definitely so. It's a drizzly morning. I'm
Yeah.
wondering if we're going to have a rainy day today and seeing, looks pretty cloudy out.
Oh yeah, last night was pretty, we had some heavy showers last night, at least in my area.
Yeah, in the city. And I know that they had already predicted that the south would get, but we didn't get to enjoy it. Most of us were asleep at that time, Gavin.
Oh yeah.
We'll see if we'll have any of that happening today and seeing what's affecting our weather in just a bit. Hopefully it does cool things down, though.
Oh yeah,
that
for
would
sure.
be appreciated.
Yeah, I know. I'm always welcoming the rain, especially it's a good excuse to stay in bed, and it helps with when you need to get to sleep.
All right. Well, we're not able to get our forecaster on the line for this morning, so we're going to go ahead and read the prepared forecast.
Yeah. So for our general situation, we are looking at relatively moist and unstable conditions that are going to continue to prevail.
And our 24-hour forecast is going to be for some cloudy spells with showers or thunderstorms being generally isolated.
Yeah. And our winds, we are going to see winds from the east to southeast at 5 to 15 knots. And for our temperatures, what are the highs we're looking at?
88 along the coast, 95 inland, and 88 in the hills.
And our low temperatures, we are going to be looking at 80s on the coast, 74 inland, and 70 degrees Fahrenheit up in the hills.
All right, and there is an advisory. Residents, especially inland, are advised to remain hydrated and avoid outdoor activity as much as possible. So that means it's going to be hot.
Oh, yeah. And for the rest of the outlook, we are looking for some cloudy spells with a few showers and thunderstorms, mostly over southern and inland areas.
All right. And so we want to thank forecaster Crystal Rosales for that update this morning. Right, so it does seem that while we may have some clouds, it's still going to be a very warm day. Do take note of the advisory for people who are inland. It is going to be warm. And of course, the Met Service keeps on reminding you that means stay out of the daylight sun if you can, and remember to stay hydrated. We're going to keep things moving now with our eye opener for this morning. And our eye opener, taken from dailyom.com, goes like this. A heart that has been broken and seen pain reveals within it a crack that allows more light in. Heartbreak happens to all of us and can wash over us like a heavy rain. When experiencing a broken heart, our ethereal cells are saturated with grief and the overflow is channeled into the physical body. Loss becomes a physical emptiness, and longing is transmuted into a feeling that often cannot be put into words. Mending a broken heart can seem a task so monumental that we dare not attempt it for fear of damaging ourselves further. But heartbreak, like all emotions, falls under the spell of our conscious influence. Dealing with your heartache in a healthy way rather than putting it off for tomorrow is the key to repair. Gentleness, more than anything else, is called for. Most important, open yourself to the possibility of loving, trusting, and believing again. When, someday soon, you emerge from the cushion of your grief, you will see that the universe did not cease to be as you nursed your broken heart. You emerge on the other side of the mending, stronger for all you have experienced.
That's a pretty powerful message. And I think it's one that's going to resonate with, you know, a whole lot of people because, you know, who hasn't experienced some kind of heartbreak, you know, in the past? You know, whether it's romantic or some other loss that you've experienced, of course, that healing process is really difficult, but it is a testing time, I think, because then how you manage it, how you deal with it, how you're able to overcome it really speaks to a lot of inner strength and focus. And a lot of the times it allows us to unlock some inner strength that we probably didn't know we had, especially because, you know, we tend to think of things like, let's say our relationship, for example, like, you know, we think if we're, you know, with somebody, you know, you love them and you think we're going to be together forever or, you know, but then something happens or, you know, or maybe it just didn't work out. Yeah. And, you know, of course you're going to feel sad or you're going to feel some sort of heartbreak, and overcoming that and moving on and, you know, growing, it's difficult, but it's really challenging, and it can be, you can definitely come out of the experience better than you were before.
Yeah, you know, I do agree. I think heartbreak is just so universal. We've all been there at some point in time, and you're absolutely right. It's not just a heartbreak for the end of a relationship or the end of a marriage. It's heartbreak when you lose something that you really, really had become accustomed to having in your life, that perhaps you weren't ready to let go. When you lose loved ones, for example, that brings an overwhelming heartbreak. You know, I feel for you, not just you, Gavin, but I mean men in general, because I think when it comes to nursing a broken heart, I'm not saying it's easier for women, I'm just saying that we are given more space to do so. Oftentimes, you know, men are the ones who really tend to have a hard time being able to recover and recover properly, allowing themselves to heal, because we've never really taught them to have that space on how to process difficult emotions. So it can be really hard. And what I love about the eye opener is, one, it kind of just reminds us that it is universal. We've all been there. It acknowledges the pain that we feel. You know, when you're going through a heartbreak, it's the weirdest thing, because you're just like, your world could be crashing down and everybody else is just going around like normal. And that's a really, really hard place to be in. If you're in that space right now, you know, we feel for you, because it's hard to imagine that everybody's just going on with their day while you were struggling to get through yours. And what the eye opener does in normalizing it and just saying that we all go through it, we all feel that deep sense of pain and grief, that it is a process, and that you have to be able to be gentle with yourself, be kind. You'll have sad days, you'll have less sad days, you'll have very sad days, you'll have days where you have no motivation, and all of these things are completely normal. The important part is that you're able to allow yourself to go through it and heal on your own timing.
Yeah, absolutely. I mean, I love that you said that. I love that, you know, that message, because it's one that we really need to embrace. And I think that the more that we, you know, do allow ourselves to feel and to get through it, it's fine. And I think that especially when we're feeling bad, and to use, you know, sort of your example, sometimes we get down on ourselves even more, because you're like, why am I feeling like this, or this is so stupid, or X, Y, and Z, and that kind of language isn't really helpful, you know. So sometimes, you know, if you've gone through something bad, you have a right to feel bad, and you can have a bad day. Everybody does it. Everybody has them sometimes, and especially if you're going through something difficult, then it's really important to allow yourself to focus on that feeling and feeling better, and you know, as you rightly said, it's especially a problem for men, because we're not really socialized or taught how to express feelings to begin with, how to deal with pain in healthy ways, how to express, you know, or have healthy outlets rather for emotions. I think that's changing slowly, but of course we're still we're still dealing with what we have now. So it's important to, you know, be kind to yourself. And I also think what is useful is if you have someone or some you know, healthy outlet, or somebody that you can open up to, and, you know, ask for help. and because somebody will have dealt with a similar problem,
Yeah.
or it could be just somebody who you feel comfortable around. And they'll also, and you'll be surprised at how many people are willing to help you through this kind of a process, how helpful they can be, not just in terms of advice in how to move on, but just being there, that definitely aids the process. And if you find, if you're lucky enough to have, one or more persons in your life who you can rely on for that, then definitely, feel free to go and rely on them too.
Yeah, absolutely. And I think the closing point is absolutely true. You do come out stronger, even though it doesn't feel that way while you're in the thick of it.
Yeah.
It's like exercise, it takes a lot of pain to get the results that you want. And, sometimes when you come out from a heartbreak, you really do emerge a lot stronger, a lot more of a stronger version of yourself.
Yeah, I think that, and then it also helps to, like, I think hindsight will also, show, because if you, whatever you're going, yeah, right? If you think about, a situation like that, and you go back to something that upset you in the past, or when you're back in the same, you're like, all right, I went through this, but like now when I'm looking back on it, why?
I do that a lot. Like I go back to times where I think there was a major crisis, and I'm like,
Exactly.
So maybe this one isn't either.
Yeah, I think one of the good messages that I heard and I try to follow whenever I'm going through something sort of difficult, they always say, think about where you were 1 year ago and what was upsetting you then, and see where you are now, and try to just put that into the context. That really does help.
All right, so there you have it. And just if you're going through a tough time, some people are grieving. Whether it's loved ones, whether it's relationships, whether it's loss of your job, just be kind to yourself. That's our message for today. But we got to get moving into our show. And we have quite a bit to get into, a number of interesting conversations. And we're starting off with a COVID-19 update. Yes, we've made it a month with no active cases, but that doesn't mean that we just say the pandemic is over. There's a lot that takes place in terms of ensuring that we are monitoring actively, that we are paying attention to what's happening around us, that we keep on preparing. And so we're going to have that conversation with the Director of Health Services of the Ministry of Health to find out what happens now while there are no active cases.
And while we're still on the topic of COVID-19, I'm sure that a lot of you probably feel like this global pandemic has pretty much turned the world upside down.
Yeah.
And we're actually going to hear a different, interesting perspective on that from an anthropologist standpoint. So we are going to be hearing from Sherry Gibbs of Galen University, who's going to be talking to us all about what anthropology teaches us about societies and the shift that occurs in societies from huge global events like the COVID-19 pandemic.
I know, that's going to be an interesting one. And then we're going to be talking to Belizean DJ Linda Blease. Linda has an extraordinary story, and I really am looking forward to hearing from her. She's been on a cruise ship for over 2 months, and they've been kind of sailing around, waiting to get a chance to come home. It's been a really challenging time from the stories I've read, and we're going to check in with her and see how she's doing and what her hopes are in being able to get home as quickly as possible.
And finally, of course, we do have something for the kids. So we are going to be talking and learning all about the Milky Way, which is our galaxy, on Kids
Not
Time.
the chocolate.
Right? On Kids Time today. So we're going to be learning all about that with Dr. Binox.
That's right. So that's what we have in store for this morning. We're going to go ahead and take a break. And when we come back, we're going to get our conversation started with Dr. Marvin Manzaneros. But before we do, we got a big birthday shout out. How dare I forget? She's been reminding us for an entire week.
Right? So, of course, from all of us here at Open Your Eyes on Channel 5, we want to wish a really happy birthday to Whitney Swift.
That's right. Whitney works with us here at Channel 5. She's the smiling face you see when you come in. I know you're going to have a great day. We're going to try to make it extra special, but do enjoy.
Yep.
All right, so now we'll take that break, and we'll be back in a few. Please stay tuned.
With over Soap and water is all you need to scrub and rub naturally.
Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we are back, and we are going to be having our first conversation. We are having our COVID-19 update with the Ministry of Health. We have joining us this morning to give us our update the Director of Health Services with the Ministry, Dr. Marvin Manzanero. Good morning, Dr. Manzanero. Thanks for joining us.
Good morning.
So, Dr. Manzanero, is it good news that we'll be hearing this morning on our COVID-19 update?
Well, in terms of where we are in Belize, I think still are relatively good. We are now day 36 since we had our last 4 cases reported. What, however, isn't necessarily good news is what's happening in the region. We're monitoring very closely what's happening in neighboring countries. And we know that Guatemala continues to have increases. I believe they are now above 2,000 cases. They are going up rather quickly. Mexico is also now continuing to increase. And I saw projections last night that they are taking it that they probably won't peak till July. They had initially said the end of May, then they said the end of June, and now it seems it's going to be in July.
Really?
So that's
Mexico, you said?
Mexico, but as I said, Guatemala is also increasing, Honduras is increasing, El Salvador is increasing, and we are getting notes that Nicaragua may actually be increasing, although we are not seeing those numbers being reflected.
Yeah. Now, when you talk of thousands in numbers of confirmed cases of COVID-19 in places like Mexico and Guatemala, how do you put it into perspective given their population sizes? You're talking millions of people in these places.
Yeah, that's always the note you have to look out for. But what you look for is also how quickly your cases increase. So if you go from 1 to 2, if you go from 200 to 400 in 2-3 days, regardless of the population, if you're doubling the rate at which you have your infection, then that's a serious concern. And that's what we are noticing in Guatemala. We are noticing in Mexico. We are noticing also that Mexico is seemingly not being able to keep up with the testing, so that they are having people dying and they are just being diagnosed as atypical pneumonia, so that in point of fact, the numbers could be much higher than what they're reporting.
So they're not, their testing protocol isn't able to cover everyone? Is that the problem?
It might be the issue of reagents, and also you will recall that we are still following the gold standard, which means you cannot be doing rapid testing. Not every lab may have access to doing the actual testing. And again, just because they are also a big country, you have to note that they will not have the ability to test everywhere. For us, it's quicker to get a sample to central medical lab. I mean, the most is 4 hours, and you can have a result in 8-12 hours. But if in rural communities in Mexico you are not able to process your sample rather quickly, then it can be a rather difficult situation.
And have there been, sort of explanations for the sharp rises in our neighboring countries?
Well, that's what had been anticipated. Having issues with waves. I mean, you will notice that most countries are not taking the rather drastic measures we took in terms of locking down. As is in Mexico, they're opening up their economy this past week. So even though the numbers continue to increase, they are also looking at the economy situation. We know some states have the autonomy to actually open back their schools, and that's a decision that they are taking. Same thing in Guatemala. We had not seen a severe lockdown until this past weekend, but then we saw the reports yesterday that people just went back practically to doing their normal activities just yesterday.
Now, you started off by saying that this is puts us in a precarious position because they are close neighbors, and we know that we have a lot of families that tend to travel back and forth quite often and not always through official border settings. Is there any kind of surveillance that has been created by the Ministry of Health to look at border communities closely over the next month or two, especially given the fact that you won't be able to watch 24/7 whether or not somebody goes over the border despite the restrictions?
Yeah, we have some informal dialogue with some of the communities, and I know there's an attempt to try to establish a more fluid communication with communities on the north and the west, because what happens is, you are right, it's the illegal entries that can get you into trouble, particularly because people are trying to hide from official sources. So even if they are ill, they probably are not going to be forthcoming to the communities, to the health system, because they will not want to say where they have been.
Yeah.
The legal crossings, I think, are much easier to handle, and that's part of the undertaking we are trying to do now with bringing back Belizeans in a more orderly kind of fashion. But the illegal entries can be the trouble for us.
Has there
I know
been
presence
targeted public health messages in these border communities, maybe telling community members to be vigilant, to report cases? Because they would be the first impacted if somebody goes across the border and contracts the virus and comes back to the village.
Yeah, that's ongoing, and what we're also trying to do is try to see if we can reach out to the community leaders to see if they can be the focal points in these communities, because we understand that, I mean, there are many things that they probably won't tell the authorities, but we are banking on perhaps them being able to tell us where the situation is kind of brewing and escalating. Yeah. So I think we have made some progress in that light in the north, but it can be a difficult situation indeed. So what you try to do is have a controlled kind of mechanism, which is trying to get people like the Belizeans that are trapped across the border or all over in an orderly fashion back home.
Is that what the ministry is working on right now, the repatriation, and how to do so safely?
Yeah, that's being coordinated with Immigration and Ministry of Foreign Affairs. We have that already plan set in place in terms of what will happen once they start arriving. We want to do it in an orderly kind of fashion. We don't want everybody to come at the same time, because so the first undertaking is trying to get a census. That's the reason why people are asked to fill a form. Mm-hmm. They will be able to come and where they actually live, because for now the only entry points would seem to be the northern and western border, but most of the flow is actually coming to the northern border station. So that's where we anticipate we're going to be having a higher number. One of the plans is to see if we can move people not only to Orange Walk, but also to Belize City, which is where we have the bigger hotels where people can stay.
Now, Dr. Manzanares, what is the safest way to do this? Because when, as outsiders looking in, you think of people all traveling to Cancun and then most likely having to bus their way back to Belize City. The level of exposure in a country that is, as you clearly stated before, doubling its cases. I mean, what really is the safest way to do this?
This is, recall when we were having people traveling back from Europe, from the US, being in a plane, being in a bus puts you at a higher risk, obviously. So you have to take the necessary precautions when you're coming back. That's why we want to do it in a planned and structured way, so that we are able to give people specific recommendations on their way back. Upon arrival, the intention is to have somebody from health screen them. If they are not having any kind of symptom, then they would go through the process of going to immigration, customs, wherever it is that they have to do, and have some means of transportation to the quarantine facility. Because the question is always how much contact is an immigration customs officer going to be having. Well, it's minimal. If the immigration and customs officers are not having that much interaction other than getting your passport, whatever stamp, you follow the process. We would not be screening people with a test upon arrival
I was going
unless
to
you
ask that. They won't be tested when they arrive?
not unless you have a sign or symptom. And we have had this discussion in the region to see how we would do it and how other countries are doing it. And it doesn't really make sense to swab arrival if you're still going to go to a quarantine facility, because we're going to assume you're negative. When will we swab you is at day 14 when you're ready to come out. Because if you are negative, then you are free to go. But because if I swab you and you're negative, you're still going to go to a quarantine facility. So you might just not be doing anything with doing a test upon arrival.
Okay, so
You
they will
will
all
also
be
be
tested,
screened-
but just
also
not
be
at the
screened-
point of entering.
Not
Sorry?
at the point of entry. At day 14,
Okay.
or if you develop sign or symptom before day 14, then you would be swabbed.
Okay. So what happens if someone is symptomatic when they arrive at the border?
You are swabbed, you will be placed in the quarantine facility upon arrival or not be asked to move. I mean, if you're coming on the way to Orange Walk or Billy City, then you can't move until we have determined your result. If you're positive, then that becomes your day 1 of 21 because then that changes. Same thing with anybody who's coming to our facility. If you are going to, if we swab you at day 14 and that's when you turn out positive, that becomes your day 1 of 21. That's a different situation there.
Now, a big part of the quarantine for people returning home is that currently they're being asked to cover the cost of their 14-day quarantine. Early in the conversation about this pandemic, I know the ministry was working, I believe along with NEMO, to set up some quarantine areas. You know, are there spaces available for people who cannot afford to pay $150 a day? I think that's the number they quoted, which amounts to almost $2,000 for 14 days.
Yeah, well, the facilities we had looked at was IT vet. Remember, these were not people necessarily who were thinking of coming from outside. Those are actually being used now for people who have jumped the border illegally. There are options available, but that might not be the best option in terms of if you're coming back from traveling. I know it's a difficult situation in terms of the economy, but we have to find a mechanism to ensure that we are also not being burdened to a certain extent with the cost, because we understand that the amount of Belizeans that are out there is rather significant. So we do have the quarantine facilities. For example, in San Ignacio, there's 5 people that I know of, and those are the 5 people caught illegally crossing the border. There are some people in Punta Gorda. There are some people in Corozal. All of them are people who are caught illegally entering the country.
You know, and you know, speaking of the economy, I did want to ask, you know, now that we are seeing things sort of open up, you know, a little by little, how do we, you know, safely manage cases going forward when we know that persons are being allowed to move about more, their access to more businesses, and you know, we can only assume that people are having more contact with each other. So how, moving forward, is the ministry planning to safely manage, you know, the potential spread or potential new cases of COVID?
Well, you know, one of the issues we have also been asked in terms of opening up is why have we not opened up completely if you now have 5 weeks without a case? We have asked that this be done in a scaled, just like we scaled up in terms of the response, to scale it down in the same kind of fashion, because I don't know that we have learned the lesson completely. I now see people trying to do the physical distancing, people you know, wearing their masks, being more careful in that light. But we do want to scale it down in terms of where we are, simply because we need to be able to prepare for a new norm. If you have a case or a cluster of cases, then you're going to have to start doing what you were doing before, which means you start the gradual lockdown depending on where you find the cases. So the intention is people trying to educate as we go along so that people are being able to grasp that concept that now we are working on the new norm.
And in relation to testing of the general population as it is now, what sort of is the protocol or the policy for persons who perhaps, maybe they may be experiencing symptoms, or is what sort of criteria is being used to manage and test the general population at this time?
Well, we are running tests right now at Tuesday, Thursdays, and Saturdays. Last week we did close to 150 tests, I believe is the final tally. What we are doing is we are testing all still frontline people. We're doing random sampling from across the country, and that's people who have more contact with the general public. We are testing everybody who has jumped the border, and we don't know how long they were there or how much contact they have had. Anybody who was having any acute influenza-like illness is being tested. And because dengue is now on the horizon, we have also determined to do random sampling of people who just show up with fever and classic signs and symptoms of dengue. So that's part of the expanded testing. In discussions with regional counterparts, it doesn't seem many countries in the region is actually doing random sampling of people who are asymptomatic. So we are looking at that possibility, because if they're saying that it's a low yield, that means you're going to be doing a lot of tests and you're probably not going to pick up any negative. So we are going to do that random sampling this week and look at it next week to see whether that is, if there's any value to it next week.
Now, so how many tests have you done on frontline workers so far? Those who weren't
I would say
suspicious, but
those-
just part of the random sampling.
If you include health officials, it's going to be, that's a sizable amount, maybe about 500 people.
Okay. Have you been tested, Doc?
No, I have not.
Okay. Now, looking at, because I'm trying to understand, I hear what you're saying in not testing asymptomatic cases, but as, all the information comes forward and we're learning more and more about COVID, but still definitely not enough, we do know that a substantial number of people may be asymptomatic. Let me ask you, do you think that it's possible that right now in Belize, there are asymptomatic persons passing on the new coronavirus to others?
It would not seem so, and I know that there's many unknowns, but
What makes you
if
think
it
so?
is the case, because we are not finding people who are ill showing up in the health system, and we are testing everybody who is ill. So if it is, in point of fact, what you're saying is happening, then we will have to be, I would say, a very lucky group of Belizean people that are not developing any sign or symptom. But I don't think that's happening right now. I'm not seeing.
I think you freeze. Yeah, you're freezing. Hello?
Yes, can you hear me now?
Okay. You were saying you don't think that there are currently any active cases perhaps moving around silently, since we do know it can be passed by
No.
asymptomatic persons.
Yeah, but then that would be testing everybody who's showing up ill, and none of them are turning out positive. That's one. We are not having a significant amount of people that are ill. So if that were the case, then that means that we have a cohort that is not developing any sign or symptom, and we will have to be extremely lucky for that to happen.
Okay. And looking at our current testing capacity, I know the numbers has always been a part of the conversations you have to have. How many tests do we have? How many we have that are going to be acquired so that we can be allow for a sustained testing over whatever amount of time it takes for us to beat the pandemic?
Hello?
Yes? Did you hear my question?
I couldn't hear what you...
I was
Did
asking,
not.
what is the status in terms of the number of tests that can be administered at this time?
We at the last check we were close to 6,000 tests that we could do, but that's also one of the reasons why our colleagues in the region, counterparts, were saying we have to be careful with just doing random sampling, and you're not picking up anything because the entire region still remains low in terms of their stocks supply for.
Yeah, we're having a lot of challenges with your connection at the moment. So you're saying that the stocks are low across the region. Have we placed an order? Are we awaiting further tests to come into country? Or we're just at 6,000?
No, we are expected to have up to about 12, 14,000 in terms of a total amount. But we still need to be careful because if you start having a second or third wave, you need to have reagents for those possible scenarios.
But when is that expected to arrive?
Well, we have different delivery dates. Even some of the supplies beyond testing reagents are still coming in. Dates keep changing. We had some for the middle of May. Now it seems it's going to be for the middle of June. And that's why I think counterparts in the region are saying we have to be careful with how we go about doing the planning if we're not picking up anything with random sampling.
And I just want to go back very briefly to, to jump off of Marlene's last question, because one of the concerns, and I think you had raised this earlier in relation to specifically Mexico, is that when in several countries there's a concern about underreporting of cases because there may be more cases of death or perhaps more cases of things like pneumonia, whereas people have not been diagnosed. And I just wanted to clarify that you were saying that you were saying earlier that in our health system there's nothing to suggest that there's any sort of underreporting of cases based on the data that's coming out of the health system.
Yeah, because we are testing everybody who is even, if private sector sends any sample to those are being processed. But in the public health system, we are not finding people who are ill or who are dying of respiratory diseases. Then we are not seeing an unusual pattern of more deaths, if you will, because you will say, well, it affects other systems. So we are also not finding other diseases that people are showing up with that could explain any potential COVID-19 cases that we have not detected.
So looking at what we're seeing currently, I think one of the concerns is looking at the what allows for a person to be tested. Are we still using the protocol of persons who have respiratory illnesses alone, or are we also including some of the other symptoms that we have seen reported in other parts of the world, like the gastrointestinal type illnesses and other strange symptoms?
Yeah, not everybody who has gastrointestinal illnesses, yes, but some of those are being swabbed. Some people who are just showing up with fever and joint pain are being swabbed. People who are severely ill inside the public health system and are hospitalized are swabbed. Okay. We are moving towards testing people who are in ICU care, for example. So that becomes our representative sample because those are random taking for testing, and we are not finding cases.
Okay. Now, what happens during this time? So you're doing random sampling. We were able to successfully contain the first wave of COVID-19. You said repeatedly that, we're not in the clear, we're not COVID-free, even though people very loosely use that term. But we should anticipate that there is the possibility, a very strong possibility of a second wave. This also means that it's an important time for the ministry itself and the healthcare system to kind of regroup and assess and be able to make changes or enhance how we respond when and if there is a second wave. What is happening in terms of the planning for that?
Yeah, well, that's one. It's very important that you say that because the changing dynamics of COVID-19 allows you to mandates that you go back and review your plans. So we are looking at having all the plans that we have tie up into one single plan and making sure that continues to be socialized. I think the bigger challenge for us in health is opening up back the health system and now trying to deal with other diseases that are coming up. Chronic patients are starting to come back into the health facility, trying to work with an appointment system. Pregnant moms coming back into the health system, picking up the vaccination schedule, and dealing with potential dengue outbreak as we are expecting it to happen. Is how we're going to be able to manage all those other diseases amidst COVID-19. And I think that's the difficulty that we are having. We are, of course, reviewing surveillance plans, but not only for COVID-19, it's for the entire other spectrum of diseases that we routinely have. That's where the challenge is actually more than COVID-19 for now then.
So you're saying that it's a plan that will allow for being able to address whatever needs arise with COVID-19 and also be able to handle whether it's dengue cases or people who have complications based on their chronic conditions. We know a lot of people usually have babies later on in the year rather than the beginning. So these types of things are what you're trying to figure out how to co-manage.
Because people are coming back and you might have been traditionally used to a specific form of our health system works. Or all pregnant women would come on a given day, but now we're trying to find kind of like a ticketing system that will allow people to come back and not everybody at the same time. Same thing for chronic diseases. The spraying schedule will now start in terms of the dengue situation that's expected now with the rain starting to come in. But you can't forget COVID-19. And once you start having any other case of COVID-19, understand that some elements of the health system will need to continue to happen. And you still need to scale up your COVID-19 situation.
Do we still have designated flu clinics?
They still are functional, yes.
Yeah. And how are we doing in terms of reported cases of flu? Because the flu season usually ends about a month ago, no? March, April?
Towards the end of March, we are not having an increase in number of flu cases. We probably will keep them until the end of this month through the middle of next month. And then depending on how it goes, we go back to doing routine activities, whatever routine now, a new routine then, because it's not going to go back to being normal, and still being on the lookout for potential cases.
Well, you know, that it's interesting that you say that, because I kind of wanted to get your view on sort of what generally you would say COVID-19, what sort of changes it's brought about in the healthcare system and the way that we manage these sort of things. Because as we know, we've seen, and I think when you were a guest previously, you had spoken about this in relation to how we'd managed things like pink eye. And you know, when knowing, of course, that we do have persons who are more vulnerable to different types of infections, has COVID-19 brought about significant changes in the healthcare system, and do we expect those to be permanent?
Well, I think it's asking us to rethink how we will go about addressing the needs of the population. So, for one, we used to have maybe a diabetic clinic on a given day or a hypertensive clinic on a given day. We don't think that that's the way it's going to happen now. We are going to have an appointment system spread out throughout the day, spread out throughout the week. We do outreach through schools. Like, for example, we did a review yesterday with technical advisors. The dental health component, for example, is done routinely through schools in Belize City, but now there's no school. So you have to find a mechanism of delivering that message. Vaccination schedules that are done through school cycles. We have to find a way of getting them. For example, the HPV vaccine, which is done in standard for girls, we don't have access to the population now.
Yeah, because their second vaccine is due, right?
So all those things, you have to go back and rethink how those will be done. There's many other programs that we used to do, educational systems. NDAC, National Abuse Control Council, that does a lot of the education through the school programs. We'll have to get creative because it can't be a new norm. So there's almost all layers of the work that we do are affected. Nutrition has elements that deals with the school system. It can't happen again, or at least not for now. And we also have to plan in tandem with new school cycles if and when that happens.
Yeah. And I want to come back to that just a bit later in the conversation and how you envision schools, what school will look like at the end of the year. But before that, I want to ask you, what is your assessment of how the team managed the first wave of COVID-19? And what would you say is going to be done differently or better when and if we face a second wave?
Well, I think there was a good work done from the public health standpoint. I think there was a significant amount of contact tracing done. And this is people who have done contact tracing for other diseases, be it malaria, elements in dengue, HIV, you can't forget HIV. Of course, every disease has a different dynamic, but I think it's classic public health that allowed the teams to do a rapid containment mechanism. That's one. Two is the response of the health system. It may have been delayed, if you will, in some aspects, but I think we were all learning as we go along. So I think that will allow us to have a better response whenever there's a second wave.
So what I hear from you is that you're saying you think that the strength of our response to the first wave was in our public health, and especially in our contact tracing. So if that was the strength, what would you say would have been the weakness?
The weakness is trying to deal with a health system that was not entirely prepared, not because we didn't have the people, but because we were learning as we moved along. If you look at what we said in January, February, March, we were changing our plan because of what we were finding, even in terms of surveillance system. But it's not only what was done in public health. I think we have to take a look at two other layers, which is the response that we got from government and the oversight committee saying, going ahead with all the lockdown measures that were instituted, but also the people's response. I think you can't deny the fact that people responded. You did not find people like other countries are doing, where people are saying open up, for example, or demanding that we open up. I think people were willing to abide, and you can't take that away from the overall response. So I think it's that three-pronged approach, which we did call for, where we said you need an all-of-community and all-of-government approach. I think that's what has worked in this regard. I think we are better prepared, and of course things are going to change as we move along. But I think we are as prepared as we can be. I don't know that I can say it in any other way.
You mentioned something interesting, and it reminds me, I can't remember where I read it, but there was this particular point that was made, that when after the pandemic you don't see a large number of deaths or a crisis situation, one of the inclinations people may have is thinking, well, we did all of this for nothing because there wasn't a big issue that we had to deal with, when in fact we did all of this, and so the result was only 18 cases. Are you, how do you move forward knowing that there will be a heavy level of skepticism in lockdowns and restricted movements if we do enter into a second wave, especially knowing now what the economic implications can be?
Well, I think we'll have to be able to balance with people what the implications are. I mean, we can give raw numbers in telling people, okay, this is the projected amount that we're going to have, projected amount of people that are going to die, and the potential cost it will bring. You would also see some people give some very raw projections elsewhere. We are saying people are going to die, and this is the amount of people that are expected to die. When you look at the US, for example, they are telling you this is the amount of people that we expect that will die as a result of what's going on. So once you're able to say that, then we hope that people can internalize that and make a decision in the Belize context. If I tell you, use dengue, then dengue killed 10 people last year. What happens if I tell you, if we don't do our part this year, you're going to have 10 deaths as a result? How much are we willing to sacrifice and invest to ensure that 10 people don't die? It's the same thing here. You can do projections for COVID-19 once you have a second wave and say, okay, this is a projected amount of people that will be in the hospital. This is a projected amount of people that will die as a result. And then you strike that balance. You doing something versus you.
Yeah. And the second part of my earlier question, in terms of what will be different in our response for a second wave? What is going to change now that we've had that first experience?
From the public health standpoint, I think for healthcare workers, it should minimize exposure because we should be better prepared in terms of who you suspect is a COVID-19 case. And I think that's happening as we go along. So one of the elements in our favor is that we have had ample time to prepare. I think that's the potential thing that is going to change is our response should be quicker, much more structured. And even with people coming from outside, I think the ability to us to do it in a certain kind of way, allowing certain people to come in at a certain time period, allows you to have a better response. I think it's going to be much more structured with less exposure to health staff. That's the way I'm seeing it will go now.
And do you feel comfortable that we're adequately equipped with what we need?
In terms of supplies, yes, and we continue to receive the PPE kits and everything, assuming that we're going to be having a second wave. There's a specific area in the offices in Belmopan that has been assigned just for storage of supplies and equipment.
And in terms of perhaps, the training of the personnel dealing with this, and we know we've received assistance from medical professionals from Cuba in managing this. But in addition to that, how about the actual persons the frontline responders and the training that they've gotten? Can you speak to us then, I guess, sort of about the level of training and preparedness that they're going to have for if there is a second wave?
Well, there is an online platform that was developed through the work with Dr. Hidalgo that I delivered close to 30 sessions every day, 1 hour and a half every day for doctors. There's a current session being done with Comisca for mental health responders. We are going to develop a mental health plan for healthcare workers and the community at large. We just got a platform also that's going to be in Spanish for people coming out of Spain, because most of the platforms are now online. We have moved towards the procurement of the support for online platforms. Those activities. We have Saudi Arabia to do online education, online continuous medical education. I'm not saying that that's the ideal. It's the ideal under the circumstances that we have. Understanding not everybody can participate, but that's as close as it can be for right now.
Yeah. And looking forward, we have two things that I wanted to touch on. One, let's talk about the potential reopening of specifically the airport, because it doesn't look like the land borders that would be something smart for us to do. But when and if foreigners are allowed to fly back into the country, from the health perspective, what are your thoughts on this and what will need to be done to keep Belizeans safe?
That's a question that has a changing answer, I would say, every day. We are in discussions with counterparts in the region because other Caribbean countries. So looking at that, I can't say that it's the same thing for Central America because most airports are now at least partially open for commercial flights. I know neighboring Cancun, for example, never really locked down the airport.
Yeah.
So for us, might be the ones in the region. I don't know if there is a straight answer because we are still looking at process flows, how potential arriving patients or passengers would be coming through the airport. We have had an initial discussion with BTB.
Have we acquired the rapid tests yet? Sorry to interject.
No, we don't. No, we don't have. But even if we have a rapid test, we still have to look at the process flow because how rapid will the result be? If you have a flight coming in of 180 people and you have to swab all of them, that's a delay already in terms of getting them through the airport. If anyone turns out positive, you have to send that sample for a confirmation to the central medical lab. Then does that mean you quarantine the entire plane until you have that result? Those are the kinds of questions that keep popping up. So even if you have on the horizon a rapid test, it's not going to be that easy. As I said, this is an evolving answer, because we are looking at what other countries are doing. One of the ideas thrown out is that maybe people should be tested prior to them boarding a plane, because when people go to an airport, you have 2-3 hours where you're waiting until you board the plane.
Yeah.
That might be part of the norm, and I think it's a question that comes up with civil aviation authorities, airlines in the region, because it's not going to be such an easy answer to say, okay, you have the rapid test, everybody can come, and this is what you're going to do. We have to look for setting up health facilities now at the airport, at the border entry points. That's part of establishing new norms in as you start to think of opening up situations. I know that's a soft date given for July 1st, but I don't know. It's contingent on many other factors as well.
Okay, and lastly, schools are opening up around the world, and we're seeing a lot of changes there. We're seeing where sometimes kids are going to school on shifts. A lot of schools, some have moved their classes outdoors. There's a lot of focus on social distancing within the classroom. You know our reality here in Belize. What are your thoughts on when the children are allowed to go back to school, how the classroom will be different?
We had a preliminary discussion with Ministry of Education last Friday, and we're having one this Friday, where we tossed out the ideas of the school calendar, that notion of having 2 shifts, maybe going 9 to 12 without a break, and maybe 1 to 4 without a break, maybe concentrating on the more on certain kinds of topics, or going on in a certain week, Monday, Wednesday, Friday, and the following week go Tuesday, Thursday. All those ideas were thrown out. I don't know that we have a specific answer, understanding that maybe children have to wear maybe a face shield, not a mask, to prevent people from touching their face. Children, that is. All these things are being processed now with Ministry of Education as they come up with a plan. We told them that they need to also create a contingency plan in case you have a new wave coming in. Maybe the school year won't start in September. Maybe it needs to start earlier. If you're assuming you're going to have a second wave towards the end of the year. There are many ideas being thrown out. I don't think that there's a straight answer. For example, CSEC exams I know will be in July, August. So they need to prepare for that. And understand that we're going to be living under a new norm. Even the issue of the amount of people that come from across the border to schools in the Cayo area, that was initially discussed, because I don't know that will be able to happen. There's a lot of questions there that need an answer, I'm sure.
There's a lot of figuring out that has to be done. But in the meantime, there are a few certainties that we do know, and that's how we prevent the spread of any infectious disease. Doctor, you want to close with kind of just what we need to keep on doing, remind ourselves how to protect ourselves and the rest of our family during this time, because we are not in the clear as it often feels.
Yeah, I think we have come a long way. We do have to give credit to everybody in that aspect. It's not only just what the Ministry of Health has done, it's what we have done as a community. Understand that physical distancing, the hand washing, those will remain, and that should be, if you want to call it a rehearsal for when a second wave comes, I think that's what we want to ensure that people get the message, is that we change our behavior for whenever we get any new cases.
Okay. Thank you very much, Dr. Manzanero.
Thanks for the invitation.
All right. And with that, we are going to take a break. And one of the things, Gavin, we talked about quite a bit just now is adjusting to what the new norm is. So we're going to have a conversation with an anthropologist from Galen University, talking about what the new norm is, how we interpret it, and just the shifts that take place in this pandemic. So that's coming up in a few. Please stay tuned.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.
into our second conversation for today as we discuss with an anthropologist about observations as to what's taking place, how humans are responding to what has been the biggest crisis in our lifetime, and that is facing the COVID-19 pandemic. So we have Sherry Gibbs with us. She's joining us, and she is the Dean of the Faculty of Arts, Science, and Technology at Galen University. She is an anthropologist, and I'm sure very keenly observing everything taking place in Belize and around the world. Good morning, Sherry.
Good morning.
Morning. Hi, morning. Thanks so much for having me on.
So we were chit-chatting just a bit, and I think it's a great launching point. Just you said that you and other anthropologists are kind of just really paying attention to how we as humans are responding in this pandemic. You know, what are your initial observations or the main things that seem to stand out about the Belizean reality?
This has been really, really interesting for me because most of the discussions have been centered around what's happening in North America. Mm-hmm. And so we have a completely different perspective, really, of what's happening. I think we've been so fortunate that the number of cases have been so low. When I share this, people can't believe it. And that we've really accepted staying. I mean, you know, we're not out on the streets where you see in the US and other places, people protesting, saying, no, we want to go out. But we accepted and we said, okay, we need to go home. We need to stay home. We need to practice our physical distancing. What is it that we can do to keep each other safe and healthy? Yeah. And so it's been really interesting for me because I wasn't sure what was going to happen at first, right? When you started to hear all of this going on and even just the talk of how nothing like this has happened during our lifetime. And it made me really stop and think, and really, and then to see the level, and then to really understand that, yeah, globally, we've just been hit health-wise, economically, and socially, these social constraints that have been placed on us. I think Belize is doing extremely well, and really kind of nice to see that we've, I think, really come together and respecting what's been asked of us. Yeah. Even though it has been difficult, extremely difficult.
Right, and I think that must be really interesting to observe from an anthropological perspective, the different responses in the different countries. So when you look at a country like Belize, what are some of your thoughts on, perhaps, from your perspective, maybe looking at our like culture or some features of our society that have allowed us to sort of manage the COVID-19 in the way that we have?
I think, and I heard somebody else mention this too, and I wish I could remember who and where, but Belizeans tend to be sort of law-abiding citizens, and we're really peaceful people, and so in times like this, we all stepped up and said, okay, this is what needs to happen. I think when you compare our reality and just the history too within the region, I think this is seen as a real safe, peaceful place to be. And so it's not really surprising then that I think we've just sort of accepted, there's been the odd, here and there, and you hear of, people breaking curfew.
Yeah.
And I think we also really need to understand the whys behind that and how difficult this really is for people. Student in Belize City saying, this is really going to hit some people hard because maybe where their confines are, right? We think, yeah, maybe for me it's okay, I can stay at home, I'm still able to work. I have open space, I have a yard, but there are people whose reality is very, very different, and they may just have a small room. And if you're not able to go out, and if you're used to being out and spending time with people and seeing, it really has can have a real negative effect on mentally.
Yeah.
So just that we've been able to do that and to say, no, we're going to protect each other. Yeah. And ourselves and stay home.
That's a very interesting perspective. I don't think I have asked, even myself, just why people would be out when there are very clear regulations and what perhaps motivates them. And it would be something to explore further. I think the assumption we just make is that they're rule breakers or taking chances. But what you notice is really interesting, and I've been saying this so much. I feel like for a time, we as a society were being portrayed as chronic rule breakers. Yesterday, the commissioner said 1,300 people were arrested over the entire course of the state of emergency, and that's curfew, that's illegal crossing, that's face masks. That's less than 1%. That's less than 0.5% of our population. So we have been, by and large, adhering to the rules. What does that say to you about us?
I think Belizeans are, like I mentioned before, I think just really conscientious and understand the severity of this, and saying, yeah, okay, it's tough on us, but we're going to do this and we're going to make sure. Now, some of it, and what's been really interesting too, is to see these discussions on fear. And so how much of it actually has to do with fear, and so not wanting to go out and being afraid that you're going to get it. Is it, okay, these are the laws, I'm going to follow them, or is it, no, even when it lifts and we can go out, you know, like we can go to a restaurant and have some food, there are still going to be people who are just going to be extremely fearful, maybe paranoid, and not wanting to. So what part of that is driving? Is it our concern, our fear for our safety and not knowing who other people are and what they've been up to? Because you remember when all of this started, you could really sense that and see that real panic and fear, right? We saw it on social media, the things that were being said about people, everyone was scrambling to try to figure out who were these first cases. And the comments and the things that were being said about people, the stigma that was attached to it. And I think, you know, so not wanting to be one of those who get sick, and being kind of, you know, not so nice to these people, you know, how did they get that and what were they doing? And, you know, like this was a real malicious thing that had been done. And so that was really interesting to see. So a lot of that being driven by fear. Now, as we're starting to go through, one of the things with pandemics and how they end, I was listening to what Dr. Manzanaro was saying, you know, we may have the second, even third wave. But right now, we're seeing this, especially in North America and in Europe. Is it a social ending, or is it going to be sort of the medical end of this pandemic? And I think what we're seeing is more of the social push, maybe driven by economics. There's still people dying. There are still new infections. I've been following in Canada, like Quebec has opened up the schools, but they were the hardest province hit, and there are still people dying, but yet they opened up schools and they've started to relax. So it's been interesting. It's not because this pandemic is over. It's just that the economy's had enough, or people have had enough, and they're pushing to say, we need to open up. We're done with this.
But you know, it's interesting that you talk about the response of the general public to the pandemic being driven by fear, because I think that that sort of will dictate a lot of what's going to happen moving forward. And I know that we're kind of talking about this in the context of what is the new normal and what are going to be the everlasting changes. So if that is actually the case, do you sort of expect, or have you had thoughts about how people are going to adjust, and whether or not, the sort of measures that people are taking in terms of, for example, physical distancing, is that going to last now? Are people going to stop giving hugs and all stuff like that?
Well, that's funny. I've been thinking a lot about that. When it first started, you'd be meeting people, and some people were like, no, this is it, physical distancing.
Yep.
Others were like, so we're Belizean, and I'm still going to come up and give you a hug, and it doesn't matter, this is not going to affect me. I think we're going to see a little bit of both, and it's going to be up to that individual to sort of set their boundaries. And what we might start to see are those physical boundaries that people now are able to set.
Yeah.
Maybe they wanted to have them from before, but weren't able to say that. But now they can say, nah, this is what's happening.
Yeah.
And that's one of the things, again, like going back to, is it a social end to the pandemic, or is it going to be a medical end? If it's social, it's more slowly. So, that the disease is still out there and people are getting sick and people are still dying. And so you're able to keep those new norms. So we're still having that, I don't like the word social distancing, that physical distancing.
Physical distancing.
right? Are we still going to have those lines or the circles in the shops or on the sidewalks? And are we just going to automatically start to follow them? Like if there was a vaccine that was found right now, and that was it, it was over, I think we might slip back to our old way of doing things. But
Yeah.
as this is stretching out, these are going to become our normal ways of life. I was listening to Dr. Manzanera, and he was talking about airlines coming in, and I was thinking, like, I can't imagine Belize having to really be responsible for doing rapid testing on everybody coming in. You almost think that should be happening
On the other end.
Right.
Yeah.
So if you're leaving from Canada, the US, or Europe, you're getting tested there and you're getting approved, and then you get on. But just imagine traveling. And so our airports are now going to have to expand. Are they going to have to reevaluate now how they move people through?
Well, there's already travel advice talking about you want to add a couple more hours to get before you get to the airport, because now there's physical distancing, so
Yep.
things move slower. There are temperature checks. There's a more, in terms of your checking, because you have to be careful of passing on any illness. It's more slow and detailed. So it's already starting, these changes. And I wanted to tap into your experience for that, because anthropology looks at our behavior, but it also uses a lot of history and what's happened before to help us understand. So in the 1918 pandemic, we did a lot of the things that we're doing now. There were face masks, there were lockdowns, there was social distancing. A lot of the public health measures took place then. And things eventually normalized after the pandemic, but some things did stick. And one of the most interesting things I've read is that back then, it was very common practice that everyone shared a cup. It was a communal cup. And it was outlawed during the pandemic, and ever since then, we've all gotten used to using our own cups.
Our own cups,
So,
yeah.
and then if we move forward to things like 9/11 and how that impacted how travel changed dramatically. So these big crisis events can lead to permanent changes in the long term. From your observation, what do you think is going to be, the outcome of this pandemic in terms of the new world we'll be living in?
I kind of have a feeling, although, because it's also highlighted a lot of the inequalities that we really have, and that's oftentimes what pandemics do, is they expose all of those, the underside of what we don't really want to see, but that's been there all along. And so all of these social and economic inequalities. I want to say that I think the real digital age that we're really, this is maybe the real push or the good launch for it, because of how, so me, for example, and at Galen, we haven't missed a beat. Our spring semester finished up on time. Students were sent back, were sent home, I think 3 weeks. The last 3 weeks of classes, we've already started our summer semester. Actually, we're in our third week. We have 6 weeks left. So everything is going, but because we already had that platform. And so we were able to easily and seamlessly switch to being online. So many companies, businesses, organizations are still doing that, still conducting business. There's obviously some challenges that are having to be dealt with, and they're calling this, this disruption, and how we can take advantage of it. So I think this has been an opportunity for people to be really innovative, to be creative, to figure out how to keep themselves going, the organizations, the economy going to some degree.
Yeah.
But almost half of the population of the world doesn't have access to internet. So, on the one end, and I'm wondering if we're going to start to see more of a divide, maybe because we have this access and because we've been able to operate, and you get frustrated if the internet gets slow. Sometimes students get kicked out. And one of the things that's been, again, like Belize, and the more I'm talking to you now and how you'd mentioned it, I think Belize would make a really great case study to be able to show that we at Galen have been able to keep going. All of our students have had access to internet and have computers. But I was reading an article, I think Barbados, they had to cancel, I believe, their summer semester because they found out that not all of their students had access to internet.
Yeah.
So it's been interesting that a lot of universities may have wanted to continue, but again, that reality that, you know, we assume that because you're going to university that you must have access to all of these resources. But the reality is that no, a lot of people just don't. And how are we going to keep them up, right? How are we going to be able to move ahead and have everybody at the same pace moving along? Are we going to be leaving some people behind? And, you know, I think that's something to really be aware of and to keep an eye on.
Yeah, and I think that, you know, it must definitely be something that you've thought of in a more general sense, you know, in terms of the response to the pandemic, how it affects different people. And you had touched on it a little bit more earlier, when you were discussing, you know, people going out and perhaps breaking curfew, but it's because of the situation that they may be experiencing in their home. So, of course, the response to the pandemic must have also, you know, exposed what are a lot of the big differences that we have in society, what are the weaknesses we have in some of our institutions. So, you know, from your perspective, I'm sure you must have made some really interesting observations.
Yeah, and that's a lot of what I've been also reading. But those observations, discussions that we've been having and projects that we've been working on, looking at and understanding the reality for some people who may be experiencing domestic violence. And so, you know, you have to stay at home and you can't go out. Well, now you've turned this horrible situation for somebody even to, you know, just magnified it. And what are they going to do? Do they, I don't know, and this will be something I have to go back and check, if the numbers are coming in, if the police are getting calls. But it's difficult. If you imagine yourself as a woman who's in a situation like this, you may not have access to the phone, that may not be available to you. You can't leave the house to go to a police station. But then if you do call the police, where are you going to go? Right? Because there's nowhere to go. You're not supposed to be out. You're not supposed to be on the street. Maybe you're not allowed, can't go to family because you're not supposed to be mixing, right? And you imagine all of these things going on in someone's head, and what are they supposed to do? So these are some of the realities that are being recognized worldwide, but to really look at how that's affecting people here in Belize and what we can do about that. How can the next time, so how can we be more aware of that? How can we ensure that we protect everybody, not just from the virus, right? But the regular things that are happening within society.
You know, and I think that we don't have the numbers. We did discuss it with the Women's Commission a bit in looking at the preparations they were making because they were anticipating the same. But we use a lot of the experience of what's happened in other parts of the world to kind of guide us and let us know that there is a possibility. And we definitely saw in other parts of the world where there was a spike in domestic violence cases during the time of lockdowns. But that's a jumping off point I'd like to use to ask about looking at some of the similarities in how we as people have responded during the pandemic with other parts of the world. You know, we use a lot of US media because that's mostly what we're exposed to, but I find that people have been reading many different stuff online as well from different countries. And it's interesting because they call it infodemia, where there's just all this information and that it's not necessarily easy for people to filter what is accurate and what may seem to be accurate. So we've seen a rise of conspiracy theorists. We've seen mistrust in what the reports may say. And this is not atypical to what's happening in other parts of the world. Tell me your observation on that.
Yeah, it's been interesting. Like, you can talk about, again, kind of with the fear, the paranoia, this geography of blame. We want to be able to blame somebody for this. And so in doing so, we're trying to, we're using them as a scapegoat and sort of push it off on them so that we maybe can absolve ourselves of responsibilities that we have. How we're looking at people, the xenophobia too. It happened with H1N1 when it looked like that influenza virus was coming out of Mexico. Mexicans were treated very, very harshly because of that. Even during the plague, Jews were seen as the ones causing it, and so they suffered horribly. So finding somebody to blame, and I think when you see all of this information, I think it started a little bit here, but then it seemed to ease this bit of xenophobia and looking at our Chinese members of society and in their shops and things that people may have said to them, and sort of looking at them as causing this. I haven't really been seeing or hearing much about that, and so again, maybe we've.
I think that's because we were a bit late in getting cases, because what we saw, I think, was more
I think so too.
The stigma that you mentioned earlier for people who did in fact get the virus.
Of people coming in, and so those, I think this fear at first, shut down the borders, don't let any, and it didn't, and it was interesting because you have Belizeans who want to come home and not trusting them. All of that information, how do you weed through it? How do you decide what is correct and what's not? Do you wear a mask? Do you not wear a mask? You have doctors saying, yes, you should. You have other doctors saying, no, you shouldn't. Do you save them for somebody else? And I think we have to and I think we've been seeing that as a society. We've just sort of accepted that this is what we're going to do, and this is what's being asked of us. We need to follow through with this, and hope that we're all going to come out okay from this, especially with our economy. We want to make sure that we get this sorted out quickly, but then it's not really for us to decide too, because so much of our economy depends on tourism. And if those regions of the world that we rely on are still sick and people are still dying, we don't want them to come in. And so I think this again is another thing for us to look at, is maybe we really need to diversify our economy, and again, that being creative and innovative.
Well, it's interesting that you bring up this topic, because I think one of the most frequent conversations that have been happening worldwide has been in an economic context, and sort of centered around perhaps some of the weaknesses in some of our systems. And we know that Belize is of course a good example, but we're not the only country where perhaps the measures that have had to have taken place because of the COVID has resulted in lots of people losing their jobs, or people losing a huge amount of their salaries. People will be struggling to survive. We perhaps have not seen what is going to be the full effects of that are going to be yet, but surely a lot of discussion has been centered on what are the existing weaknesses with the system, whether and how we should continue moving forward. So I'm wondering if you've had any thoughts or observations about that in terms of the economic system, and how sort of we do business and commerce, and how we're able to survive.
Yeah, I've been seeing more discussions on that, what people are looking at and thinking of doing. There's been a lot of activity on social media, people coming together and having these kind of discussions and conversations, which has been, it's provided this opportunity of this like really thinking outside of the box, and how are we going to approach this? We've seen that agriculture is something that maybe we need to start focusing on. That supply chains, another really big thing, where we're getting all of our stuff from, how it gets held up in different places, who has control over it, who can stop what we have coming in. Not really looking at, how you can be more self-sufficient, but at the same time, we're part of a global economy, and so we need to be a part of it, and we can't just shut everybody off and say, no, we don't need you anymore. We don't need any of those imports. We're okay on our own. We need to be able to export and diversify.
And of course,
but how can we, mixing in with other regions? Go ahead.
No, I was just going to say that another thing is that we've also sort of had to reevaluate sort of what the position of the government is going to be in a case like this, because in our example, of course, we've had some sort of economic relief that has been offered to us, a relatively limited extent so far, but of course, both here and abroad, we're seeing discussions about whether or not we need to move to more socialized systems, whether or not, how much, the importance of having safety nets and the government's role in implementing measures that ensure that people are going to be all right, especially in the context of a health crisis.
Yeah, and I know there's been a lot of discussions back and forth too. Socialized healthcare, are we seeing in places where they have socialized healthcare? Have they come ahead okay? Are people being looked after okay? The U.S. just keep going back to them as that example because they don't have that kind of healthcare system and how difficult it's been for people to access. Here, I think, again, just because we had so many few cases, and I think the Ministry of Health and Public Health was able to go out and doing their testing and their mapping. Again, just highlighting that we're okay. I can't imagine what would have happened if we got hit like Europe and North America. I remember sharing with a friend that an experience of being up at the hospital here in San Ignacio and there's only one ventilator, right? And so what happens if all kinds of people start coming in? But I think the concern, right, that you have these countries that have these economy, that social safety network that you were talking about. What happens after this? Has it been used up? So what happens if there's a second wave or a new pandemic, and being able to fill those coffers again to be able to keep, or just even regularly being able to have, to be able to fund your socialized healthcare and to have your welfare systems and your unemployment. It's something that we don't have here. How are we going to be able to now start generating that? When we look at Social Security, are they going to be able to keep going? We're going to, all of the money that we've been getting, we're going to have to start paying that back. How are we going to start generating money to be able to fill those accounts that have to be drawn on? It's interesting, for social needs.
It's interesting when you think of it and how the country has been functioning. The heavily financed ministries were not the ones to help us through this particular pandemic. And in fact, it was those that are traditionally under-resourced that actually had to be had to get this pump of last-minute resources. Human development had to get assistance. Health needed tremendous assistance. And so, while they'd been neglected or just kind of categorized as lesser important over the years, the inefficiencies just became highlighted. And I know that tends to be the case in a lot of countries. You focus on the places that you make money. So tourism and infrastructure has been a big priority for a country.
I think a real shift of focus is what's going to take place, our priorities. And I think we've had enough time to maybe think about it. People have been appreciating their families, having this time with each other, and where are your priorities? What do you really value? Do you need to be going out and spending all kinds of money out? And how is that then going to affect? So if we start to shift our own priorities and maybe looking at doing things and spending our money differently, how is that going to affect the economy? But then also with the government, they're going to now, this is highlighted everywhere, the need for, like you were mentioning, these social services and healthcare is going to become huge. But how do we now deal with education, and how do we ensure that we're getting all of our kids are being educated and continue to be educated during this time? So what is it that we need to do with education? Do we need to start looking at these online options in case something comes up again? Because it's not just, it could be any crisis. It could be hurricane. I remember years ago that flood that hit us, and we were blocked off from Banque and at Galen, we had to shut down, I think, for a week or two. And we didn't have that online component then. So, if we did, we'd be able to keep going. And so again, today, a hurricane hits, some disaster hits, or another health crisis hits us. We need to be able to continue moving along. And so education needs to be looked at. The other interesting area too that people have been looking at is environment, and how we're starting to notice around the world places becoming cleaner. The air is a little bit cleaner, except here with the fires. And I think because we've been spending so much time at home, and I'm kind of thinking, I've been trying to figure out, has this been yes, you're talking about the fire season this year has been bad, but I've experienced other times where it's, been really, really bad. Are we noticing it more because we're all at home and we're not in our offices and in our AC buildings? And really starting this discussion, I've been seeing a lot of people talking about this. So what is it that we're now going to do about these fires? And it's talking about culture change. So our culture is going through a change right now. To see, how we deal with this, we keep up with the physical distancing, looking after each other, being more neighborly.
Yeah. I think you mentioned that, and it was a part of the conversation we didn't really get into, because I know in talking with some of the regional health experts, one of the things that they did discuss was whose culture was closest to ours when we were looking at transmission. Because where perhaps in the Asian countries, they naturally kept a bit of distance. In Belize, we're very huggy and kissy, and we're close to each other. Personal space isn't something that we feel very rigid about. So I think, I've always said it right here on the show, I miss hugging, and because it's such a natural part of who we are. What do you think the implications are? Now, and for some time, there's been a lot of conversation about what the mental health implications will be. There's some experts that are saying that there'll be a level of PTSD that we're going to be collectively experiencing just for the rapid change that we've had to endure.
Yeah, that's something, it's trauma that some of us are going to come away with. And mentioning the mental health aspect, I think, is super important. You've been all of a sudden cut off, right? And people who need and want that contact with people, and family too. Belizeans are really, I feel like family oriented. There's these large families and getting together, being able to go over to somebody's house and barbecuing, and and now, and not being able to do that, I think has been extremely difficult. And for the elderly too, I think they're a segment of our population who, if we're able to go and to reassess now, who really probably struggled with that, where they don't get those visits. They're kids who are living in different districts when you just cut off and you can't travel there. And you're seeing that a lot in other places where families isolated. What if you don't have access to, again, internet, to be able to have those live chats with your family,
or learning how?
So it's still there. You can still see them, you can talk to them. Yeah, learning how to do it. Yeah, that's been even with my parents, having to work with them. All of a sudden, camera goes off, and where are you?
And even being able to, with my mom, getting her to watch church on, the live stream.
Yeah.
And that in our society, a lot of people are very reliant on their faith.
Right. And so, I've been thinking about this, or wondering if people are seeing this as kind of superficial, that, maybe you don't have to leave your house anymore. Maybe we can do everything. You can even now get your vegetables delivered to you. You really haven't had to leave your house if you don't want to. You can do your church online, you can see your friends, you're doing your job. If you're still fortunate to have that, get your food. Are we going to become couch potatoes and just sort of stay at home and become socially isolated and just really start to rely? Because this became a discussion, especially looking at young people, right? And all the time that they were spending on their devices and in social media. Even going out to restaurants, but you're on your phone, you're not actually physically socializing with the person. Are we going to become more so? Some people have been saying that it may be the total opposite, that we're just so frustrated at being at home and seeing this as being really superficial that we're going to start going out in droves now. And that might be one of the issues if we start to see a second wave, that people may be going out even more than they did before. So it's really, you're at this cusp. It's really hard to say which way it's going to go, because it depends on how people have been feeling as they've been locked up. I've been talking with students, and some are totally fine. Miss, I'm in my pajamas and I'm in bed. And
Yeah, some introverts are real happy.
Right? Yeah. Others just hate it.
Yeah.
They're still able to do classes. I know they don't like that they're stuck at home doing it, but you're at home, you may as well do something.
Yeah.
One of the interesting things, it hasn't just been for us, but other, like those online, those MOOCs, edX and Coursera, they've been seeing a real spike in people interested in continuing studying.
Yeah.
So people accessing more courses, realizing that, look, I've got this time at home, I may as well make it
Learn
to good
something
use,
new.
because I can at least try to advance myself, right? So if
Yeah.
I'm home, let's see what I can do so that if this was to happen again, I'm in a better position. Or when this is all over, I'm going to be in a better position.
Absolutely.
I think it's a lot of reevaluation. People are taking stock of their position and looking at what's going on. And I think we're going to start to see, there's a number of elections around the world coming up soon, holding people accountable and demanding more from their public officials and of what they want and what they've seen.
Yeah. Well, I mean, we could continue this conversation all day, but we don't have the time, because there's just so many things that we can observe. We haven't looked at crime. And I also think, one of the things to pay close attention to is just how human behavior can change when the novelty of the virus wears off. In other words, we're 4 months in, at least for our reality here, and it just doesn't feel as urgent and scary. It's still scary, but not as much as it was maybe in February or March, and how that may impact us moving forward for future restrictions. So, from your perspective, though, you were sitting with some of our young minds in the classrooms. We're all collectively experiencing something that has literally not happened in over 100 years, that everybody across the world is dealing with the same situation. What do you find to be of collective interest as people who are looking at anthropology? What's the most interesting area that everyone seems to be observing?
That's a really good question. The area that everyone seems to be observing, just in regards to what young people have been doing, they are, I think, they're becoming more creative, how they're interacting with each other, this new social media platform they've been taking advantage of, chatting more, reaching out to people a little bit more. So their social network hasn't necessarily dropped off. I think, if anything, it might be expanding. And I think they're becoming more aware of what's going on, because you can't help it, right? Like you were saying, it's just, there was information overload before, but now it's just everywhere. This is really, it's hard not to pay attention and to see what's going on and what people are talking about. And I'm hoping that they're being critical as well of what they're seeing and reading.
Yeah.
So, yeah, that's
well, you probably have some interesting class discussions, and we're glad that we just got you for a little bit of time to have something like that on air. We do appreciate you sharing.
Yeah, thanks so much.
Sharing your insights. Do stay safe.
Thanks, you too. I appreciate it. Take care.
Okay, thank you too. And with that, Gavin, we're going to take a break, and we're actually going to be exploring the experience of a Belizean who is marooned on a cruise ship for over 2 months, and her hopes in being able to come home and how she's been surviving. So after the break, we're going to be joined by Linda Blees. So please stay tuned. and we're moving into our final conversation for today, where we get the opportunity to check in on a well-known Belizean. Of course, she has been a resident DJ for Celebrity Cruises, and she is joining us live off the coast of Costa Rica somewhere. We have with us Linda Blees. Good morning, Linda.
Good morning.
Good morning, my happy folks. How are you doing? Am I all right?
Linda, I'm so happy to hear from you. And let me just start off and ask, how are you doing? You've been at sea for over 2 months.
Gal, I know I tell you that me all happy things, but at least I work for a company that try to take care of me, especially like when it comes to Celebrity Cruises and that type of stuff. They really me try like look out for you and that type of thing.
Yeah.
So I may help with some of the anguish of having what we call on cruise ship land cabin fever now.
Yeah.
I think that more the changes and not knowing when you're actually on step on land, than me more like when we bring on, I leave it at anxiety, if you know what I mean.
Yeah.
Because you watch the whole world, they got through this panic and all of this, and then you just not know like what they call next type of thing.
Yeah.
Well, you know, that it's interesting, like, because, you know, I wanted to know, like, how has the process actually been like for you? Because obviously when you got onto that ship, this wasn't, none of this was, you could have imagined anything like this happening to you. So can you kind of like talk to us a little bit about the stages of, you know, sort of what you went through?
Well, first of all, when we find out that, well, you know, everybody kind of informed that they had a virus that broke out worldwide, like virus COVID-19. So we may like leave it, the tech precautions when it comes to, first of all, on cruise ships, they have different stages of how we deal with, how you call it, like an outbreak when it comes to anything from like a common cold to like diarrhea and that type of stuff. Like we have different stages of like preparing for that, or like containing a situation like that. So when we find out that there really one problem, they did to announce that they want to stop cruising and all that stuff and take off the guests then safely and try keep we in a somewhat of a quarantine away from society. So we had to clean the ship. We had to start wear masks just for get in like the habit of keeping our bubble safe.
Yeah.
If you know what I mean. We never allowed for touch things like usually you could go to the water fountain and get your water and that type of thing. Like we never allowed to do that. We'd have to get water from somebody else, somebody pour the water for somebody else to serve it, and all them people that have on gloves and masks as well.
Yeah.
You would have to like that. It was a lot of like extra, like even when we received mail, like because we couldn't order thing off of Amazon if you need like the simple groceries or whatever. And when it comes on the ship now, the captain would have make them sanitize the box thing. Then when you go pick up the box thing now, you have to put on gloves and mask, and then you take out the groceries out of the box, and then you sanitize every piece of grocery that you have and put it in your personal bag. Then you get to carry that to your cabin.
Yeah.
That like one, it just make it really. It became really about just to protect your bubble, just to protect your society and where the inner everybody health, because all of we live together with a share kind of the same air type of thing.
Yeah.
So it may get really stringent, and I appreciate it because I mean,
You never
a healthy. So
Yeah.
So are you confined for the most part to your room?
no, not necessarily. We had like 14 days after like confinement to Fui cabin, just to make sure we clear certain CDC laws, like you know American laws for like be allowed for have at least some of we crew members get home.
Yeah.
If you know what I mean.
Yeah.
Because they never allow we off of the ship because they had this kind of like regulations that we had to follow for even try get we back into society as crew members type of thing. Because later we had to catch flight, you know, we have to catch flight from America and try to go there somewhere else or whatever if the country is open.
Yeah.
So we had to do a 14-day quarantine. Majority of we had to do it. I just speak from my half, you know, from my company and my ship, because other people had different experiences, and some people even had outbreaks of a COVID-19 for their ship. But my ship, me lucky enough to never have that situation. So I'm just grateful for all of that.
So
a lot of people not even have internet to talk to people.
Wow, wow. So you definitely do count your blessings. Linda, you know, I think for people who don't know, cruise ships are very limited in space. They're big, but they're limited in space. And the crew quarters are notoriously small. I mean, you turn around from one room into an next. How does this not make you, I mean, how do you keep your sanity in such a small, confined space for over 2 months, and especially with the uncertainty as to what will happen next?
Well, from we have, my ship personally start on trends, kind of like all the fleet wide. My captain, my lady, when named Captain Kate, she like really popular. She got like the first American female, whatever, captain. Love she's the best ever. She decided for put we into guest cabins, because we had like, I think we had like 1,700 crew or something like that. But apparently we had 1,700 balcony cabins. So she just decided to put me in a balcony cabin since we don't have guests and then type of thing. And that really may help the process one leave it, especially the fact that we get locked in a cabin for 14 days. That leave it the extra space. Me do wonders. And I like that to me force everybody to go in a their cabin.
Yeah. That's really thoughtful. And I think you've said it quite clearly that that's not the case across the board. Linda, this has been a tough time for crew workers in the cruise industry. Your situation is one, but you're talking about thousands of people stranded on cruise ships across the globe, just floating around, not knowing how they can get home. And in fact, there have been reported cases of suicides. People are jumping off the ship because they feel so helpless as to what's going to happen next. How do you feel when you hear stories like that?
I didn't want to tell you that. I don't want to say, man, you know, anxiety, that's something a lot of people can't fight off. I can't speak for people because everybody got through for their own mental process. You know what I mean? People have their own things that they deal with. All I could do personally with the people around me that close to me that try to keep them encouraged, I just speak from my perspective. I personally saddened by even the friends that even feel that type of way. You know what I mean? Like I could understand, because I had moments of like you just kind of want to know what it come next, like what happen next. Matters we just stuck out here, then you read all the comments of everybody that act like you got some type of virus or something, and all you wanted to get home. You know what I mean?
Yeah.
So it kind of I could understand, but man, girl. You know that I'm not a chipper person. I really try.
Yes. I've known you for years. You can lighten up any situation.
But I can't even. I think the worst thing that for say your friends then and then chant for go home and they try get home and can't reach home because the governments or the countries locked down.
So this happens this is happening in a lot of other countries. That your co-workers can't get home. I read of one situation where people went on a hunger strike to try to force the country to let them back in.
Yeah, people that on hunger strikes, people that feel it, people that cry, people that back outside of their country can't get in. Man, there are people that have families and are just like me, you, whoever. You know, it's easy to say, well, we don't want to do this and we shouldn't let home for we own people, but I don't have no idea how you feel like to just hang out here and be stateless. Like, you see one whole thing that happen home, you're that far away from your family, you can't even help if you're not there. Anyways, but.
It's hard, isn't it?
Yeah.
Let's keep it happier, yeah?
So,
I think I want to acknowledge, you know, Linda, knowing your personality, you're a DJ, you love hype up things, and You like people being happy. That's one of your missions. But this has been, I could only imagine, extremely challenging. With what has been indicated so far, you said you see things online with people behaving almost like you coming home is bringing the virus. How does that affect you?
I just want people, especially when it comes to my personal country, which I believe, make them understand perspective for one.
Yeah.
Know that at least we personally, the out here, just to try get home. We not to try in a no type of way come and contaminate society. If you did a work and you stuck, and you don't have nowhere else to go to your workplace, not to pay you, you just did there. Man, people may get vexed because them they stuck out at San Pedro and their family members couldn't come to Belize City. How you think about we were just to float around in the middle of the ocean?
But, you know, in that sort of, I guess in that context, I was going to ask sort of, just to jump off of Marlene's earlier question, you know, what then, you know, what keeps you positive? You know, have you been able to, you know, talk to your family? Has the support from your other crew members? How has that been, you know?
I'll be honest with you, the company that I work for tried their best for like keep we, you know, social, but still, you know, distancing, if you know what I mean.
Yeah.
But like the energy of the people that are around you, especially cruise workers for one, it takes a lot for them for actually, that's just one different breed of people. It takes a lot for them for actually come off sad or come off low alpha vibes, because we've known to keep people and keep people happy and very welcoming and that type of stuff. So the people around me help, internet help, my friends stay home. I know they lie to you, I've had moments that I call my auntie probably or something and I feel leave down and what's not, because I just read all the news updates and everything and I feel a little bit of anguish. But things they look forward and they look happier, so that not take me long for like just start feel happy all over again, if you know what I mean.
Yeah, I've seen you've even taken up crocheting of all things.
Yes, friend. I didn't embrace my granny life.
What a way to kill the time. But your story is interesting. So let me break it down for our viewers. So you went to work, you went out on one trip, you know, the virus started spreading, the passengers were quarantined, eventually let off, and then the crew stayed on and kind of just stayed out at sea without knowing when this would change. And in fact, there are many ships out there that are just kind of sitting around, like literally sitting ducks, waiting to figure out how they can get people home. Then you were transshipped, and you were grouped by regions onto a ship where you're now being delivered home. Explain that to us.
First of all, when they decided to do no sail, as in no sail order, like as in we weren't sailing with guests anymore.
Okay.
By then the time when they done that and let off the last guest thing, they had one ship in a free company that was still sail around for at least a month, but some guests couldn't get there off and that type of thing. Because countries may done the shut off their borders, so they couldn't send we home. Like even if they get we off of the ship, and most of the companies, they kind of liable to their crew members, so they can't have we just the boat. They can't just let we off of the ship and say, well, bye.
Yeah.
Transferring ships was different. I never yet meet. I actually did on one ship now with 15 Belizeans, 15 other Belizeans, somebody from Orange Rock, somebody from Cotton Tree. It's pretty cool. Some people from Belize City. It's pretty nice to meet people, because usually we not get to mix and mingle with each other like that. It's been an experience mainly because all of we kind of share the same sentiments after just to try get home. So I think the most saddest thing that when we try to drop home, like Panamanians that I did, and they're like, well, we not accept we cruise workers from Panama, so we're not going there again. Then the next day, and they're like, well, we're not going to Colombia again. And then to the finally, they put home Costa Ricans. So with a feel a little bit more optimistic, but they have agreed to fly home Panamanians, so that's good for them.
Okay.
Instead of sailing them they agree for fly them home, so that's good for them.
Yeah.
I just take things as one daily thing. I feel like, some people, they feel anguish and stuff like that, and we try to keep each other encouraged.
So I
Man,
can't imagine pulling up to a port or planning to go to a port to drop or to go home if you're a Colombian or Panamanian and being told, well, you can't. And now the ship is at Costa Rica. It's making its way up in the Americas. And you're going to be expected, you and the 14 other Belizeans will be expected to be dropped off home, right?
Yeah.
Linda,
saying that we follow all.
Sorry, go ahead.
Saying that we follow all of GOB expectations of, like the cruise line has followed GOB's instructions or whatever, and we filled out whatever form is there for us to fill out, and we get accepted into the country, right? So that just everything just tentative, but I just happy for them on the way home, man. Like, man, 2 months has been way too long. I'm grateful for the company and all of that, and they keep us fed, and they keep us healthy, temperature checks twice a day. And they try to keep our spirits up, but I think when you're not at work and you not have a real purpose for like why you're there, because I lived at Belize, you just kind of want it home.
So I should say, the forms have gone up online. I know a lot of parents have been asking who want to bring their children home. So they're now online. You have to fill out a form for the Foreign Affairs, and you have to fill out a screening tool as well, and it's an application process. But Linda, there's also a 2-week quarantine period in Belize City. Not in Belize City, but when you arrive. The last communication from the Prime Minister, he was saying that he's hoping the cruise lines will cover the cost of the 14 days of quarantine you'll have to do when and if you get when you're allowed back into the country. Do you know if your cruise line is covering that cost? Because that's almost $2,000 if you have to cover it.
I know, right, gal? I brought my pocket. No, that's a joke. As far as I know, from FWI's side, is that our company has agreed that if we have to pay, like if we get charged for quarantine or the time that we're getting quarantined, they want to take care of the cost of that for their crew members. This to come from Royal Caribbean and their umbrella company, which are like Azamara, Celebrity, and all that stuff. That's what they tell we. Now, clarifying all of this, that just me that just ask questions from both ends, because me want to make sure when I reach there, when you book an appointment, you just want to make sure your appointment's set. So I want to know a lot of things. Like, first of all, who chooses the places that we want to quarantine? Like, did they list places? They list places already or no?
Not yet.
That we choose the place. So I just try to figure out. They said they don't pay. They're like $110 a day, right, for 21 days. That insane?
Yeah, it's 14 days. They're averaging about $150, I think they said, a day.
Mother fella. All right then. Well, as far as I know, my company say they paid. So
that's good. That's good. Linda, I hear it in your voice. You are ready to come home.
Gal, me always ready for come home,
It's an unbelievable experience that you've had. What's the feeling like from the other Belizeans who are on the ship with you?
Then just want to get home. I think across the board, all of we just have the same feeling. We just want to get home and get safe, do it quarantine, and they're on with family post quarantine.
All right. Do you know when the ship is supposed to arrive in Belize?
They said this weekend, but the all about if everything get processed and all that type of stuff, because once we don't get permission, we can't reach, right? So that's what it is.
If you don't get permission by this weekend, what does the ship do?
I guess we're gonna try carry some other people somewhere else and then come back, circle back again.
Unbelievable.
I know. Well, I mean, as you said earlier, you're taking it day by day, right? So I guess also with the other persons on the ship, Have you still been able to sort of, I guess, develop at least sort of a routine or any kind of thing that kind of gives you a sense of what's good of normalcy?
I don't think no part of society, even on ship or on land, will ever be what we prior may know as normalcy after this COVID-19. You just have to occupy your mind with things. Me personally, all I did, we have set times that we eat. We have temperature checks twice a day just to make sure, nobody they catch one cold or even have symptoms of anything.
Yeah.
And that's been happening for the past 2 months. Every day you have temperature checks early in the morning and in the evening time. You have your set dinner times and what's not. But besides that, then just encourage to make you just keep social distance and wear a mask all the time and sanitize your areas. That's like that kind of normal life, but not really normal because you're not socializing. And human beings, they're very social people. So.
And you know what's interesting as well, for when you do eventually come home, we know that one of the big adjustments in the wake of the new normal is that a lot of people, as it currently stands, bars and nightclubs are closed, and the traditional venues for a DJ are not happening. But we've seen like an explosion of DJs doing online shows and perspectives. So have you thought about stuff that you're going to do when you get back?
But I tell you, me not just DJ, but it's okay.
So you
I
have
think
no.
I'm all right when it comes to trying to figure out stuff to do. I have some projects that I work on. DJing, that one of the things that end up just to expand on my end, and like everybody else, you just try bank on one talent that you have that pay the most, kind of thing. So.
All right. Well, Linda, we are so grateful that you are available to check in, that we had a solid enough connection to be able to keep the conversation going as well. But what would you like to say in closing? What would you like to say in closing to Belizeans who are watching about what it feels like to not be able to come home, or with the possibility of coming home? What would you like to share with them?
Firstly, I want to understand that we, the Al family, we the Al Belizeans, we the out here, even if we're out here with the day, we Belizeans that choose to come out here, whether that's for school or work or whatever, trust me, none of we'd ever expect all of this to happen in the world, especially upon this magnitude. I'm in a better situation because at least the environment I around, they try their best to accommodate with. But they have people in a worse situations. I don't want to feel like, I don't understand why we want to go home, but we have no other choice but to get home. So, because we get sent home, doors closed from the company, we don't know when they're open back again. Nothing no better than home, like what that, like if you lock out of your house type of thing. So we not try in a no way try contaminate the society or put anybody at risk for anything, because we are follow every order that the day. And yeah, keep on the social distancing thing. Wear on a mask, please, Jesus Christ.
Well, Linda, thank you for checking in with us, and we really do hope to see you home soon. Take care and stay positive.
Yeah.
Hey, appreciate it too, yeah? Take care of yourself.
All right.
Stay healthy out there.
There you have it. That was the experience of one Belizean who is on a cruise ship. Unbelievable to think, just floating around for over 2 months, and hopefully they'll be allowed to be home by the end of this week, because now the application forms are up, and you can now contact the Ministry of Foreign Affairs and be able to get your arrangements in order on being able to come home. We are going to shift gears now
Yeah. So parents, get your kids around the TV. It's now their time, of course. So we today on Kids Time, Dr. Binox is going to be teaching us all about the Milky Way, and of course, Kids Time is our segment that is brought to you by our friends at J&W Shopping Mart. So gather kids around and stay tuned.